This is disorder of immune system, misunderstanding of immune system, that they attack to the nerve system, and they, with the time, they consume and destroy this texture of the nerve system called myelin. Mostly is happening in the age of the 20 until 40 years old, and more than 70% of the patients, they are female. The factors can be environment, can be genes and DNA from parents, can be alimentation. I here add two of the factors that I have done this research, can be even radioactivity and frequencies of the satellites and phones. That's why in the last years this number is going always higher and higher. The white globules attack to the texture of the nerve system myelin. They consume it during the time, and they reduce the rate of the commands from the brain to the nerve system from 100 meters per second to the 10 meters per second, and sometimes they cut this communication. We call it axonal transection, and that's the last step of the illness, that the nerve system has been cut and there is no way of communication, and after that is coming the invalidity and not feeling some organs and some part of the body. Mostly symptoms of this disease is the eye problem. When you are moving your eye left and right, you have pain, or maybe you feel it's like you're watching behind of the blurry glass, or there are a lot of pulver and sand in the air. Can be that you feel like a tingling, or maybe ice in your food, or you don't feel it. It's really a strange feeling. For example, you're walking through the house, but you feel you're in the beach and you're walking in the sand. And some other symptoms can be urinary incontinence, muscle weakness. Having these symptoms doesn't mean actually you have MS. Can be from neuropathy, or maybe spinal problem here. For MS diagnosis, you have to do a lot of analysis. You have to do the MRI, and it's really important first to make sure if the symptoms they don't belong to the other disease. As a cure and healing for this problem, in the last year have been offered a lot of ways, and there have been injections that they reduce the attacks of MS. For example, beta interferon, that's the injection that is reducing attack of the MS, but has side effects like pain, a lot of pain and fever can be side effects of beta interferon, and some tablets that they are reducing more than 70% of attacks of the MS. In MRI we can see these white parts. They are close to the cortex in the brain, and it's really important where we have these plaquettes in the brain, because in the brain we have part of a strategic part and not a strategic part, and much more plaquettes they are close to the strategic parts, so would be much more damage to the organs and body, and much more dangerous for the patient. Mostly patient, they are asking you how many plaquettes I have, and actually that doesn't important, and is really important where it's happening. For example, if you have some plaquettes in close to your spinal cords can cause you much more problems than more than maybe 40, 50, 60 plaques in your brain that they are not close to the strategic parts, or they are sleeping. This disease can present himself in different ways. Sleeping way can be attacked. If you have attacked just 1 or 2 times in the year or more, it's really important the number of the attacks during a year. That says how difficult the case is. Sometimes MS patient, they have just 1-2 attacks and it's finished, and they don't have any other symptoms for years, and they don't even feel it. Sometimes just with because of the other problems, they do analysis and they do MRI, and in the MRI can see the white plaques on the brain system and nerve system, but the person, they don't have any symptom of MS. That doesn't mean if you have this problem you will be invalid, or you will feel it and it's cancelling some part of your life. So in the last year, the cure that has been offered for MS is using the stem cells, and they got a really good result. That's my personal research and project, that there is a way to cure MS, and that's go through the communicating with intelligent system of the white globules. Actually, white globules, they have an intelligent system that can accept the inductions, and we can communicate with them to going back in their place and the position, and that's coming through the really special training to communicating with the cells, and has been cured MS in some cases. So in traditional medicine, I have a really effective research and correcting behaviors, some special physiotherapy and activities is really answering good to the MS, and my personal experience with patients. Parents, they're really important. For example, if we have mother has this disease and father doesn't have, is like almost 5% can be the next generation challenging this problem. If father has this problem and mother doesn't, is much more person that can happens to the next generation. And if both of them they have, I personally ask them to not making children, because we are risking more than 30%, and 30% in medicine is really high number and really high risk.